start right now. Hi and good morning. If you are here, you are tuning into Pennie's Community Workgroup for August 2023. We welcome you and thank you for joining us today. My name is Marie Ortiz. I work in operations and I'm here to kick off today's session. So buckle your seatbelts and enjoy the ride because today we have a packed agenda full of resourceful information to share with you. So let's go ahead and dive right into the housekeeping items. This call is being conducted and recorded through MS Teams Live. All attendee lines have been muted just to limit the background noise. Feel free to use the chat feature. If you have questions, we do have Pennie staff members available and monitoring the chat. If you have customer-specific questions, please call Pennie's dedicated Assister broker line, and that number is 844-844-4440. Last but not least, we don't want to get between you and lunch, so if you have to drop, you can always refer to this content at a later time. All you have to do is go on agency.pennie.com. You click on Workgroup, and there you'll find the material and prior recordings as well. So now that we've covered housekeeping items, let's preview today's agenda. Today, we'll start by providing an unwinding update. We'll talk about accessibility widget, discuss broker training, and preview early assister training. We'll talk about citizenship verifications, transitioning to Medicare, and how to prevent duplicate accounts. Finally, we'll finish the session with information on how to serve Pennsylvanians' non-citizen and immigrant population. All right, so we are going to go ahead and start with Kelsey with the unwinding update. Take it away.
Thank you, Marie. Good morning, everyone. As always, we'll just give a quick little update with the unwinding. Everything's kind of business as usual. No major issues to report. Since we last spoke, we are still contacting households via direct notices and mailers, emails, priority outbound calls, and texting now, which is, I think, something different than the last time we spoke. We are now able to text the account transfer population. So within a customer's 120-day SEP, they'll should be receiving around 4 text messages from Pennie, just reminding them to come in and enroll. Should somebody enroll, though, they would be opted out of the future texts beyond that. So that is exciting. We're kind of hitting people as much as we possibly can and communicating as needed. So that's great news. Our second bullet here, we participated in 11 press conferences so far, although there is another one next week in Lancaster, so that number will be 12 here soon. And something that was a little different and interesting that we did in July was we held a live ABC special on July 19th, where our executive director, Devin Trolley, and the secretary of DHS both did a segment on ABC about the unwinding and the assistance available through Pennie. So that was definitely an exciting opportunity to get the word out. As always, our collateral is available for stakeholder use in our toolkit on our toolkit page, and the DHS toolkit is still available with Pennie materials in there as well on the DHS unwinding webpage. And then our advertisements and media campaigns are still there and running in the market. We will probably be having a new ad campaign run here soon for the unwinding, just to freshen it up a little. And all of our outreach activities are ongoing with our sister network and the YMCA Health Equity Tour. So that is just kind of an update on what's happening with the unwinding. Everything's going great so far, and we are preparing how to balance the unwinding with open enrollment here coming soon, but we'll present more on that in future meetings. Next, I'm just going to kind of run into a new feature that we currently have on our website. In a way to increase accessibility on our website, we have recently installed a widget called UserWay. It's called UserWay Accessibility. This widget allows us to offer a more accessible experience for all users and ensure compliance with the Americans with Disabilities Act. This widget can be found at the bottom left corner of pennie.com and agency.pennie.com and is available on all web pages. Once you click on that icon, you can view the list of support features it provides. These features include support for users who experience visual and/or motor impairment, color blindness, dyslexia, and many more. This slide currently we're displaying an example. This is text spacing that you can click on. That's a feature. This increases the amount of space between the characters, as you can see in that bottom picture. This helps to aid readability for dyslexia and then also visually impaired users. So we're pretty excited about this. We're providing to keep providing these types of accessibility tools for our customers. So we're going to be continuing to find new ways to ensure customers are receiving the best experience throughout their journey with Pennie. All right, and then moving on, I'm handing it over to Hannah to talk about broker training.
Thanks, Kelsey. Go ahead, next slide. Yep, so we are up for everyone's favorite time of year. It is time for our updated broker training. This is for the 2024 plan year. It is coming very soon. We'll talk about that at the end of the section. Go ahead and go to the next slide for me. So as a reminder, for anyone who wants to become Pennie certified broker, you can come in at any time throughout the year, starting with this new training that's going to be live very shortly. You'll be able to be certified through 2024, so basically through 12/31/2024. The 2024 broker training modules have been updated for the new plan year. We've done some updates on policy operations content and, of course, broker system trainings and the annual privacy and security training required by law. So the courses are still being offered through the Train PA platform. We've used that for the last couple of years, so I think folks are familiar with that. So it's at free, no cost to you. It's 8 modules plus the final exam. Once you've completed that, it can take up to 5 to 7 business days before your account has been Pennie has been updated to reflect your new certification. We just need time to review your account, your eligibility for certification, and your license status with PID. So next slide. So anyone that's currently a Pennie certified broker does need to complete their 2024 recertification training by the deadline, which is 10/31, so right before open enrollment. Nice, easy to remember. And that ensures that you're allowed to continue to serve as a Pennie certified broker through 12/31/24. The recertification modules, those courses are only for folks who are currently certified. And because you're currently have an active certification with Pennie, you're able to take a more streamlined training compared to someone who's coming in as a brand new broker to become Pennie certified broker. So it's a bit more streamlined. We do focus on really key policies that are both updates or things that need an annual refresher, like eligibility rules, in particular, things that are really important to cover. Some of the policies related to some of our strategic goals. As you know, health equity is an important policy, so there's some specific content on that, and the privacy and security training as well. Once you have finished all those requirements, the course, again, it's 8 modules plus the exam, then we will review that and update your certification end date in your Pennie portal so that it will now say 12/31/24. Once you see that certification end date updated, then you know that your recertification is all complete and nothing further is required. So we do ask that you give us about 5 to 7 business days to get that updated before you see that updated date in your account. So because we just have to review all of your information and your license status, and there's a lot of volume happening, especially at the beginning. So thanks for giving us some time on that. Now, the most important thing, of course, when recertifying is the question of what happens if you do not complete your recertification by the due date. What happens is that you will be decertified. Your certification will end on 12/31/23, and all of your current Pennie customers will be de-designated from you. Now, you can still come back after your recertification expires. you can still come back and become Pennie certified again in the future, but you will have to take the whole new broker certification course, and your previous customers, they're not going to be automatically restored. We don't automatically reassign those customers to you, so you would have to have the customers redesignate you separately. So, you know, if you want to continue your certification, it's super important that you do complete that recertification by the deadline so that that doesn't happen, and you have to go back and have your customers redesignate you. Next slide. And then one area so that is also helpful. So as you all know, in the Pennie system, we have these concept agencies. So if you are an organization that has multiple brokers within your organization, you can be set up within our system as an agency. That allows you to have an agency manager. That person can go in and you can see all of the different brokers that are in your agency, kind of like you see on the screenshot on the right, and you can see their certification status. So one thing, as an agency manager, it's really easy to go in and check on the status of your broker's certifications. So either you might see a pending status, which means that that's a broker that you've added who has not become newly certified yet. Or if you see someone who is certified, that means that they are actively certified right now. But if you want to check on whether they've completed recertification, then you would do right there, you see the little edit, and then you would see their renewal date. And if you once you see 12/31/2024, that's how you know as the agency manager that that particular broker has successfully completed their recertification. So whether you're looking at your own account where you want to see the recertification due date of 12/31/24, or if you're an agency manager, you can also see that same thing. Just always look out for the 2024 end date, and that's how you know that recertification was successful. If you haven't completed the recertification, you'll still see a 12/31/23 end date on your current account. Okay. So the broker training is coming out very soon. We are expecting to send out a blast in the next week or so to you all when that training is available. And then as we've done in prior years, we'll send out reminders to anyone that's currently certified who has not completed their recertification as we proceed through the next little while, as we get closer to the due date, just to make sure that folks realize that they do still need to complete that recertification. So look for an update in the next week or so in your email, letting you know that that is available. And if you have any questions after that training becomes available, you can always give us a call, and our contact center is happy to answer any questions you might have. And then on that note, I'm going to hand it over to Scott to talk about our assister training that's coming up as well.
Hi, Hannah. Thanks so much for that information, and thank you everyone for the privilege of your time today. I'd like to take a moment just to update everyone on the assister training for open enrollment 2023 or 2024 rather. At present, the 2023 assister training for new assisters who are coming on new to organizations, we still have that up and running. There will be a definitive blackout date for the 2023 training as we transition into open enrollment 2024, plan year 2024. And that's Monday, August 28th through Sunday, September 10th. Our launch date for the assister training here at Pennie is going to be Monday, September 11th. The training requests can be made through our agency website, agency.pennie.com/assisters. If you go to agency.pennie.com, under partners, you'll see where you can select assisters and basically access the assister resource page there. Just like with our broker training, we have two types of assister training here at Pennie. One is a refresher training that focuses specifically on critical updates and required elements for open enrollment 2024. The refresher training for current Pennie certified assisters is typically 3 modules. New assister training is 10 modules, and it's more comprehensive for new assisters, and it's focused heavily on resources and being able to help new assisters acclimate to their service here in the Commonwealth. And just as Hannah had mentioned, there will be emails going out prior to Monday, September 11th, that will, basically let folks know that September 11th is the launch date. So next slide, please. With regard to connecting with the assister training, it's still very, very simple to do at agency.pennie.com/assisters. Our assister resource page, the very first tile that you'll see on that page focuses on getting certified. And there'll be a link directly there that will link to the assister training request. You fill the form out, and ultimately you identify yourself either as someone who takes the refresher training or as a new assister who needs to take all 10 modules. So with that, we will make sure that everyone is kept abreast of the developments as we roll into September. And again, this year, the training will be as robust as we can make it with regard to updates, being focused specifically on the needs of Pennsylvania assisters. And yeah, I think you'll enjoy it. Next slide, please. I have the privilege of making introductions for something that is going to make this particular Pennie Community Workgroup a really, really enjoyable and knowledgeable experience for everyone. Today, we're being joined by two special presenters. The first of which is Cameron. Cameron is a Pennie Call Center manager, and also joining us today is Phil. Phil is a Pennie Call Center supervisor. Both of these individuals bring a very, very large wealth of information to us in terms of the training we're about to be exposed to. Specifically, they bring a unique perspective that's based upon the application of policy and how it's applied operationally. And it's a very practical approach. I think everyone's about to really enjoy the information that we're going to share. And I'd like to turn things over to Phil. Phil, thank you so very much for taking time to join us today.
Thank you so much, Scott. Very appreciated. And good morning to everyone. Thank you for being here. I appreciate that very, very much. I'm going to start off talking about citizenship verifications. You can move to the next slide, please. That would be good. Beginning July the 1st, birth certificates are now able to be accepted as a singular document for the verification of citizenship. And this is a really nice update, particularly on the customer-facing side, as that will streamline the process of them being able to fulfill these verifications when they have them. It also helps us in the call center. It streamlines our process a little bit too, so that we don't require that additional document, which in the past would usually include a birth certificate having been submitted, and we have to unfortunately reject it because at the time we needed a secondary document to support that citizenship as confirmation of the person's identity. So now that we no longer need that, it's making it a little bit easier for us on this side to go ahead and process those and get those verifications resolved more quickly for customers, which is a good thing for the customer side too, because it's going to help them move along a little bit faster. So good piece of knowledge to carry with you as you're speaking to your customers about these verifications, if they have them evident on their dashboard, then they need to provide that the birth certificate now is going to be sufficient by itself, provided that it does meet the basic criteria for meeting that verification. You know, the name does need to match, the identifiable information on there does need to match, it does need to, you know, have the correct amount of detail in there for us to be able to approve it. It needs to be legible, of course. People sometimes will submit them using photographs from their phone, something like that. You do want to make sure, if it's possible, check the document while you're submitting it or before you submit the file. Just make sure that it's legible, make sure that it looks good, so we can avoid any unnecessary rejections on that part and go ahead and get your customer moved forward in the rest of their application and enrollment process. All right, next slide, please. So for consideration of the fact that during a period of time, the outward facing communication that was in customer secure inboxes did not quite align. or our policy did not quite align with the information that was being presented inside of the secure inbox. The secure inbox messages, if you guys have seen these, you're probably aware, did specify that the birth certificate was sufficient as a singular document all along, whereas the policy didn't align with that. So now that the policy has been updated, consideration is being given to allow for some reinstatements for those customers who may have lost their enrollment or tax credits due to that erroneous information and having submitted the birth certificate as the only document because of the secure inbox message. But there are some qualifying criteria that your customer will need to meet if they fall into this bucket. So if your customer is dealing with an issue where they have potentially lost, or let's say that they have lost their enrollment or their tax credits due to this citizenship verification not having been approved when in fact they did submit an approvable birth certificate within the reasonable opportunity period before it expired and it was rejected, then we just have to make sure that a few checkpoints are met in order to be able to initiate a reinstatement for them so that they can avoid a gap in the coverage or in those subsidies, right? So one thing that we need to watch out for, actually, let me just go down through the checklist here. They need to call in within 60 days of the coverage end date. That's one thing that's going to be, and we'll take a look at a couple of slides in just a moment as we walk through this to show you where we on the call center are actually previewing these items inside of the customer's account. You can also check these as well, which would be a really beneficial pathway to take if you're preparing to call us on behalf of a customer with this issue, as it would allow you to see things that might be addressable with the customer before you actually make the call. The more things that can be seen and sort of addressed with the customer before calling in, the more streamlined and efficient the call process is going to be once you get connected with us. So these are the things that we're going to be looking for in that conversation with you and your customer to see if we can go ahead and initiate this reinstatement for them. The first item is they do need to be calling in within 60 days of the coverage end date. They do need to have coverage that was terminated due to the expiration of the citizenship DMI and not for another reason. So that's one thing we'll be checking. They do need to have in their secure inbox have received one of those notices prior to July 1st that included that incorrect statement, which was incorrect at the time, about the birth certificate being the acceptable only document to provide for that. And they also need to still be eligible, excuse me, for qualifying health plans through Pennie and not terminated for non-payment as well. So we can advance to the next slide. We'll take a look at where we are looking inside the accounts to sort of capture this information during the call and be able to see, check that checklist off and see if we can go ahead and process that for these customers, or at least get it started. Number one, the expiration of citizenship DMI reasonable opportunity period, which you can see is there listed in that part of the customer's dashboard. You can see down there in the right-hand corner of that page where the reasonable opportunity period event date is listed there. We'll be checking that. This is just for us to be able to confirm that the call that's coming into us now is within that 60 days of that event date so that we can know that we're inside the window where we can actually be talking about this possible reinstatement for the customer, right? And in figure 3 on the right-hand side of the slide, you're going to see the citizenship documentation submitted within 60 days. This is another thing that needs to happen before we can initiate any type of reinstatement for this. They need to still fulfill the verification as it exists on the account. The consideration for the birth certificate being the sole document and it having been rejected before, if there's still documents that are needed, for instance, maybe they have not submitted the birth certificate or the document that they submitted maybe was not approvable, maybe it was someone else's birth certificate, not the person that we were seeking to verify. We just need to make sure that the document is submitted before we can process that backdated, that reinstatement for them. Now, if the birth certificate was already provided and it was approvable for that person, then we'll see that inside the account too by checking the ticket, and we'll be able to move forward at that point. If we can move to the next slide. All right, on figure 4, which is on the left side of this slide, you can see the eligibility for qualified health plans through Pennie. This also appears on the dashboard. This is something you should be able to see. They just need to still be eligible for a qualified health plan. In other words, there's no other reason for which they would not be eligible any longer for a health plan through Pennie. To make sure that we can perform the reinstatement. Obviously, we wouldn't want to reinstate coverage for someone who actually is not eligible to receive coverage through the marketplace for some reason. And on the right-hand side, tying into that, you can see where we would look inside of the enrollment to make sure that they were not terminated for non-payment. We want to make sure that there's no termination for non-payment on the account as well. Lining that up with the current eligibility for qualified health plans through Pennie, just to make sure that everything everything is in place once we decide to move forward with initiating that reinstatement for them, right? We wouldn't want to do that and provide the expectation that you might be getting reinstated, and then there's another reason that it can't happen, such as term for non-payment or such as no longer eligible for qualified health plans, right? So these are the kind of things that will be happening in the conversation when you call us. These are the things we'll be looking at. These are the things that you should be able to see in most of these cases too. So if you can review this with your customer before calling in, if there's any issues there that might be resolvable with them, it would be really beneficial to resolve that with them first and then call in with us once that's resolved. So as we move through the account, we can see that the pathway is clear to initiate that reinstatement. That would really, really move things along well there. And on the last slide right there is just another demonstration of the or I should say the next slide, if we can move forward, is just the, oh, that slide was removed. I'm sorry, I have an old copy, but it's the secure inbox photo again, just to make sure that we are able to see that they did receive that erroneous communication about the birth certificate being the sole document. Okay, moving forward, sorry about that confusion. We're going to talk just a little bit about transitioning to Medicare. There are just a few items here, and we can move into the content slide, please. Thank you. Customers with tax credits and cost sharing reductions becoming eligible for Medicare. There are a few things that are obviously important, impactful elements for the customer's consideration that we want to make sure are included in conversations that we have with them about it. These will be included in the conversations if you guys are calling us with your customer on the line or to ask about this, or if your customers have called us and talked about it, they might be referring to you again later with some of this information, just to tie everything together and make sure it's all on the same page. Becoming eligible for Medicare Parts A and C or premium-free Part A causes customers to lose their eligibility for tax credits and cost sharing reductions through Pennie. If you do not want to keep full premium Pennie coverage, customers must terminate their Pennie coverage before their Medicare coverage begins. And this is an important element. This is an operational element that we do get a lot of calls about. So being able to preemptively address it is going to be a huge benefit. Pennie coverage will not auto-terminate due to Medicare eligibility. And if the customer doesn't terminate their Pennie coverage, they will have double coverage. Also, it's possible that customers will be liable for premiums for coverage that they had if they're letting that extend long enough. So we want to make sure that the process will include, if a customer of yours is transitioning over to Medicare, they have that eligibility, they can still keep their Pennie plan if they want at full price. That's completely fine. But they do need to understand that it will be at full price. They will not have the eligibilities for the tax credits or the cost sharing reductions. And if that changes their opinion or their decision at all, where they would not want to keep the marketplace coverage, then it's important that they go ahead and terminate that coverage for that individual who's going on to Medicare before the date or at the end of the month prior to when their Medicare coverage is scheduled to begin. This will prevent them from a gap in coverage, but it will also prevent them from having their Pennie coverage move forward for that individual with dual coverage and dual liability for premiums and the like. So please just watch out for those items in your conversations with your customers. On the next slide, since we're talking about terminating for Medicare, you can see that the option does exist also on the customer account inside the member view for them to go ahead and now terminate coverage for individuals. This was not available as a feature before. They only had the ability before to simply disenroll the coverage for the household. Now the ability is there operationally to go ahead and disenroll individual members from the coverage from the member view. This is going to be a real big benefit to customers who are savvy and would like to go ahead and take care of that on their own. If they still want assistance from yourself or from us, that's perfectly fine. Just give us a call and we'll go ahead and help them walk through that. But important to note that this individual termination of coverage is available for customers to do it. Looking at the coverage end dates there, what we can see is the update, the application to not seeking coverage should be the end of the current month only. And the disenroll on my enrollments, pardon me, should be choice of end of the current month or up to 3 months in the future. The contact any customer service should be the choice of end of current month or up to 3 months in the future as well. So this is no different from the normal termination process where you can select either the end of the current month, the end of the next month, or the end of the following month of that one. Who can use it? Any member can. Any member except the subscriber can use the disenroll function, though. If the subscriber is the person disenrolling, then the coverage would be terminated completely, and then a new subscriber would be identified as the head of household on that next coverage that's going to be initiated for them. Right. If we can move to the next slide. That's it. We're going to be moving into preventing duplicate accounts, to which I'm going to be handing it over to my esteemed colleague, Cameron Jones.
Thank you for that, Phil. Good morning, everyone. I'm going to be talking a little bit about preventing duplicate accounts. If we can go ahead and move to the next slide, please. Preventing duplicate accounts is an extremely valuable asset to not only the customers in the call center, but to the assisters and the brokers as well. When working with new clients, we want to just kind of be sure to check if they may already have an existing account with Pennie. By doing that, we can ask a couple of questions on if they themselves or their spouse or maybe parent has ever applied through Pennie. When they apply and fill out an application, everyone in their taxable household is to be included on that application. So it's extremely likely that they could already have an account with us, maybe under someone else's name, if not of their own. So we do want to just verify that with the caller. We also want to just ensure if they've ever actually had coverage through Pennie that they're aware of. If they have, then of course, it's very likely that they would already have an account with us at Pennie. And we also want to ask them if they've ever had coverage through healthcare.gov in 2020. In 2020, when everything transitioned over to Pennie, a lot of those households were automatically transferred to the Pennie system. And so several customers may already have an account that they're not completely aware of. So we do just want to ask if they may have had coverage in 2020 through healthcare.gov. If it is determined that the customer may have already had an account or coverage through Pennie at some point or another, we do want to just try to get them access to those accounts if we can locate them. We can do have them try the forgot password if they're familiar with maybe some of the login information, such as their email address that they may have used to create the account initially. Or we can also have them try with an access code if they have that information. We can also provide that to them at the call center if they give Pennie a call. We can also have the customer attempt to claim their account using the Social Security number. It is important to note, though, that with the Social Security number, it would be for whomever is the primary account holder. So that may be the spouse or the other spouse whose social it is under, and they'd want to be sure to try both of those when attempting to claim the account because it could be under either one. Preventing duplicate accounts is extremely important to prevent any kind of disruption that the customers may experience. This includes avoiding their accounts being incorrectly documented with any kind of outdated information for the particular account, if it's on an old account, maybe. It also prevents the customer unnecessarily uploading documents that may not be required anymore on their account. It may be being requested from an older account, and they'll no longer need to submit those documents if this is for an obsolete account that is no longer needed for the customer. It also prevents the customer having any kind of double coverage or their accounts being inadvertently terminated for non-payment of premium should we find that they are double enrolled. Double coverage can cause the customers to receive excess tax credits, which could cause potential consequences during the tax season for the customer needing to reconcile the tax credits for more than one account, although they may have only actively known about one of those accounts. Next slide, please. All right. Pennie prevents the duplicate enrollments at the end of the plan shopping process, which is before the customer moves to sign their actual enrollment application. They will receive an alert that looks similar to the one on the right. It will detail exactly who the customer is that is experiencing the duplicate enrollment to let them know, hey, we have another account for you somewhere on Pennie that already has an enrollment that is active and overlapping for the dates that you are attempting to enroll at this time. They can contact Pennie customer service to find out exactly which account that may be or what exactly the enrollment is. And this will also ensure that the duplicate enrollment isn't created at all, which will, again, prevent those issues that they may encounter during the tax season. If in the event that they are attempting to enroll into a plan and they get this alert message letting them know that they have a duplicate enrollment somewhere else on the platform, they can simply go back to the start of the plan shopping process and remove whoever the alert is letting them know already has an enrollment on the platform, and then go ahead and continue the plan shopping process for the remaining individuals on the account. They can also go ahead and give Pennie customer service a call so that we can help them to resolve the duplicate enrollment or be able to provide them with additional information in regard to where the other enrollment may lie as well. Next slide, please. All right, I will go ahead and pass over to Eric.
Thank you, Cameron, and greatly appreciate our contact center representatives being on the call today and this group getting to hear from the people who really are on the front lines at Pennie and take all of your calls and take the calls of our customers and do an amazing job at being a wealth of knowledge for those individuals who call us. Today, my name is Eric Hewitt. I am with the policy team at Pennie, and today I really wanted to kind of highlight a group that is extremely important to Pennie and to Pennsylvania, and really highlight the work or the way in which you guys can help individuals who are non-citizens / immigration population here in the state of Pennsylvania. So moving into the first slide here, I really want to just kind of quickly go over, who this population is within Pennsylvania and how important they are. So in 2020, the U.S. Census indicated that there were over 900,000 Pennsylvanians who self-identified as foreign-born in Pennsylvania. That's 7% of the total population here, which I think is around 12 million individuals across the state of Pennsylvania. Even more individuals identified as being native-born with at least one immigrant parent, that being around 1.1 million individuals. Here in Pennsylvania, the population are Philadelphia, Montgomery, Bucks, Delaware is where you'll have the largest number of that immigration population residing in, with Allegheny having around 72,000 individuals. Pennie serves around 30,000 of the non-citizen population in Pennsylvania, and it is our continued goal to help this underserved population as we go into the open enrollment period of 2023. I also want to just quickly mention that the uninsured immigrants within the U.S. And Pennsylvania is about 26%. And so that's highlights why this population is so important and why we want to make sure that we are doing all that we can to help these individuals find and seek access to coverage. Moving into this next slide, I want to talk about who qualifies for Pennie quickly and how we can make sure this population is getting the help that they need. So the first group is to be a PA resident, to be a U.S. citizen, national, or immigrant who is lawfully present in the U.S., and expect to remain a citizen or national lawfully present for the entire duration of the time they are seeking coverage. So that just kind of gives you a quick overview of who is eligible for Pennie within this broader population. If individuals are traveling outside of the United States, they are still eligible to be enrolled in Pennie. It doesn't change their eligibility. Where it might change their eligibility is there's extended visits where they may go home for a couple of months. That could really change their residency status. So that's something that they would want to check in with regarding their the immigration department. Moving into the next slide. We'll talk a little bit about lawful presence and the various statuses that qualify for Pennie. Under federal law, immigrants or non-citizens are considered lawfully present who have been admitted into the U.S. legally and are present within the legally approved visa period, or has permission from the United States Citizenship and Immigration Services to stay or live in the United States. The immigration statuses listed here are those that are eligible for Pennie coverage. I will allow you to peruse those yourself. They are also available on our website at pennie.com. And you would also find those in the Pennie application when you apply. They'll be listed as you apply, and we'll see how those are listed in previous screens. Moving into the next slide, let's talk a little bit about the options for those who are not lawfully present. It is important to keep in mind that though an individual's status might make them not eligible for Pennie, they could be eligible for other coverage throughout the state of Pennsylvania, particularly those with statuses of deferred action for childhood arrivals, or DACA, or referred to as DACA, are not eligible for Pennie at this time. Though it is important to note that there is currently a federally proposed rule that could change this in future. So continue to look out for notices or information from Pennie specifically around this group as that proposed rule becomes possibly finalized in the future. Options for people not lawfully present may include emergency medical assistance for emergency treatment, public health programs, community health centers that are throughout the state of Pennsylvania, and hospital care, as well as private coverage offered outside of Pennie at full price through the various carriers they could also be qualified for. Individuals would not be eligible for health coverage through the marketplace, even at full price. They really would have to go through the carriers directly for that. Programs to lower their costs to the marketplace, and non-emergency Medicaid or CHIP. So how can you help Pennsylvania immigrant population find the options that fit their needs and situations? So moving into the next slide, I want to talk a little bit about the importance of making sure customers have brought all the necessary document and information with them to their first appointment with you, whether that be an in-person conversation or whether that be over the phone. It's really important that they have all of the information to present to you so that you can figure out what place to best direct them. When first talking with the client that has indicated there are some things you should first determine. Determine what is their current immigration status. Do they have a green card or other documentation to show immigration status, and can they readily get those documents available for you so you can review them with them? And how long have they been lawfully present in the United States, particularly when discussing the 5-year bar and Medicaid, which we will go into later. And do they have other household members with different immigration statuses, including U.S. citizens and or individuals not lawfully present? So these are just some of the questions that you can ask, or some of the things that you will want to determine before really starting the application. So you make sure you have all the information needed to complete the application when working with them. Understanding the correct documents they need to provide is also a very important thing. And making sure that those documents are available to be submitted to Pennie. You'll also want to kind of review with them how to access their notices. I say this specifically in regards to documentation. Sometimes we don't always ask for documentation at the point of eligibility determination. Sometimes we'll ask for documentation later during the periodic data matching or some other review. So it's always important to make sure that they know what documents that they might be asked for in future, and have them know that those will need to be submitted and how to submit them, and making sure that they're reviewing notices regularly to be able to make sure those documents are being submitted in a timely manner. It's also always important to remember to ask customers to bring their identification information, such as their social security number if they have one. If they don't have one, they may have a green card or other form of immigration documents that would have some numbers on them that we will probably ask for throughout the application. So it's important to have those documents available and ready to be inputted into the system. Going into the next slide, this might look a little familiar as it was presented in our July 2022 PCW call. And if you would like to go more in depth looking at the topic of Social Security numbers, I would refer you to that call at pennie.com, where you'd be able to listen to that recording and get the full presentation on Social Security number and the ITIN numbers. I did, however, want to quickly reference this document and give a little refresher that customers can apply without a Social Security number and will just leave that field blank when they're completing the application. Customers with an ITN also should leave that blank. Our system doesn't take ITIN numbers, and therefore you would just leave that blank for those individuals that have that number rather than a Social Security number. Non-citizens, as we will show in a moment, will be asked for other identifying information. As I said, mentioned just a moment ago, the green card number or another number that is associated with the immigration form that they are submitting. It is also important to remember that if someone does have an SSN, that they should always input that information into the application, and always ask if someone has one so you can include it in the application. It will just help make things go a lot quicker if they do have it, and we can include that. Even if an adult is just applying for their child, they should also include their Social Security number so we can easily run that through the application process. A quick tip though here is if a customer has an identification number, but you are not sure what type of number it is, the application often will show you what format that number will be in. So, in speaking to the Social Security number, it's got that 324 number. It will show you the format the number is in, and you would just, if you are able to match that format up, then you'll be able to know that you have the correct number to input into that documentation. Moving into the next slide, we're going to just quickly show the citizen immigration status page and why it is important to ask your customers the information that we've previously been discussing. When applying, a non-U.S. citizen will need to attest to having eligible immigration status. So you'll see these different documents here that show their immigration status. Customers should select the document that corresponds with the most current immigration status that they have and provide the requested information when they select that information there. So if it's a green card, we're going to ask for the green card number. If it's another document, we may ask for other documents, other information, or also to have the customer provide that document there. I do want to note that Though Pennie accepts the list of documents, it does not always mean that they will automatically be approved. Like an income document or any other documentation you submit to Pennie, it is subject to review and approval. For example, I want to specifically call out on the slide here, we talk about the I-797 notice. This document is one that is frequently submitted to Pennie, but it is important to note that this document sometimes has designations that will automatically mean it will be rejected. Specifically, these documents at the top of them will often say in bold letters, this notice does not grant any immigration status or benefit. Pennie is not able to approve those documents. We are not immigration and we are not able to grant immigration status or benefit. And as long as that document shows that information, we would not be able to approve a document that has that included. Moving into the next slide, we can speak I want to speak to non-citizen eligibility without with the 5-year bar, specifically regarding the 5-year bar. Customers who are not eligible for Medicaid due to the 5-year bar waiting period, which starts the date the individual first received qualified status, and have an income below 100% of FPL, can qualify for assistance through Medicaid, or through Pennie, sorry, not through Medicaid. It is important to remember that qualified immigrants are eligible for non-emergency Medicaid and CHIP and other major federal programs with certain conditions and restrictions. And there are individuals and groups that are not subject to the 5-year bars, such as pregnant women, children 18 and younger, refugees, asylees, or lawful permanent residents who used to be refugees or asylees. So outside of these individuals, if you are within the 5-year bar, you would not be eligible for Medicaid, but you could possibly qualify for Pennie coverage or be part of one of these exempt groups to still qualify for other programs under Medicaid. Moving into the final slide, I do want to again briefly highlight the first slide and focus on the second sentence of the first bullet, where we talked about how there are roughly 1.1 million Pennsylvanians who identify as native born with at least one immigrant parent. This group is very important, and it is why it is so important that, you know, when talking to your customers, you fully understand the full picture of the household and all of the different immigration statuses within the household. Moving into the actual final slide, I want to focus a little on this group of mixed immigration households here. So there. We talked about earlier on the importance of, as I said, bringing all that documentation. In mixed households, this is extremely important to make sure you're getting each member enrolled into the right program. As we talked, some people might be eligible for Medicaid, some people might not be eligible for Medicaid, but might be eligible for Pennie. Some might be actual citizenships. So it's very important to understand the complete picture of the household that you're working with. When the Pennie application is filled out completely and you've provided all the information to us, each person's information will see on the eligibility notice that you receive and the customer's dashboard the eligibility for each household member. And as you can see in the examples here, you could have one parent who is not lawfully present, so not eligible for Medicaid, not eligible for a qualifying health plan, and not eligible for APT-CSR. Another parent who is lawfully present within the 5-year bar, but could be qualified for a qualifying health plan and APT-CSR through Pennie. And then you could have within that family 2 U.S. citizen children who are eligible for Medicaid, CHIP, QHP, APT-CSR, and these individuals will all get sent to different places. So you could have the kids that would be eligible for CHIP and be sent over to CHIP, and the one parent who is eligible for Pennie because they qualify for a QHP, APT-CSR because they're, you know, part of the 5-year bar. And then you have the one parent who you may want to discuss talking about getting coverage outside of the exchange and going through the carrier directly for their coverage. In example 2, you have a lawfully present parent again, within the 5-year bar, who is eligible for a QHP APT CSR, a lawfully present parent that is outside the 5-year bar and would be eligible for Medicaid, as well as coverage through Pennie. And then you have a U.S. citizen child who is also eligible for Medicaid, CHIP, and APT CSR. So you could see how these households could really get broken up into different programs based on what they're eligible for. You're really going to want to pay attention to what best suits these families and where to best direct them. And when applying through Pennie, we're going to automatically, determine whether someone's possibly eligible for Medicaid and CHIP and get them into those right places, as well as whether they're eligible for QHP, APT, CSR. So that's why it's really going to be very important to understand what your customers are, who they are, and how that household makeup is. Putting the documentation as much as you can into the application, and then really paying attention to that eligibility notice and all of the information that will be provided there on where their statuses are. It's also important to note that individuals who are not lawfully present, so as in this example 1, you have a parent who is completely not lawfully, who's not lawfully present, doesn't meet the 5-year bar or anything else, is not eligible for Medicaid, not eligible for QHP, APTC, CSR through Pennie. This individual can still apply for their other family members. They can still submit a Pennie application. Family members who are not seeking coverage will not be asked for their immigration status, so you wouldn't have to put any of that information in there, but they would still be able to apply for their U.S. citizen children specifically, is one example I would call out there. So that really ends there. I hope this is really helpful information as we're going into open enrollment, and you're going to be dealing with a lot of these different family members, and as we work through these different households, and help make sure that we're really focusing on getting these individuals into coverage and helping this underserved population get the coverage and the help that they need. With that, I'm going to turn this back over to Mary. I think we have a couple of minutes, Mary, for some questions, if there are any questions, and that's all I have.
Thank you, Eric. All right. Well, that concludes today's presentation. Thank you all presenters for your contribution today. And it does look like we have a few minutes, and I'm going to go ahead and turn it over to Hannah so that we can address a few questions that were posted in the chat. Go ahead, Hannah.
Thanks, Marie. Yeah, I did want to touch base back on the very first topic that we covered, which is the unwinding. We didn't go into a lot of depth on unwinding today, but we have in previous sessions. So the unwinding period, for those who aren't familiar with the term that we're using, right? This is the recent rule that ended the Medicaid continuous coverage requirement, which is a mouthful, but basically what that was something that was put into effect when COVID went and started early in 2020, where people, once they were enrolled in Medicaid, they were not allowed to be disenrolled from Medicaid. That's hence the continuous coverage requirement. That requirement ended in March. So starting basically April 1st, Medicaid has started to go through, and they're going to be over the next 12 months, going through and reviewing eligibility for everyone that's on the books for Medicaid. And over the past 3 years of the continuous coverage requirement, a lot of people have become enrolled in Medicaid that may no longer be eligible. So there's a lot of folks that we expect to be losing their Medicaid coverage and therefore needing access to other coverage. So definitely recommend that folks who either need to get up to speed on Medicaid unwinding or who need a refresher, we cover this pretty in depth in a few of our previous work groups. I'd recommend going back to February, March, and April of 2023. Those work groups are available on the agency site. And we'll walk you through step by step what it looks like all the way from the Medicaid renewal process, how you know where someone is in the Medicaid renewal process, because each month a different set of people are up for their Medicaid renewal, what those communications look like, and then how people who are losing their Medicaid coverage, how they can go and get coverage through Pennie. For some folks, it's a really smooth process where it's automatically sent to us and we automatically find them determine their eligibility for coverage through Pennie, and even automatically apply an SEP. For other people, it can be a lot more complicated. There's more steps, and there's a lot of variation on that. So we do walk through it in depth. Please go back and reference those materials. It's really helpful. You're going to be getting, it's a great opportunity to get a lot of new customers who really need help. They've been on Medicaid and they don't know how to get other coverage. And this is a complicated process for folks. So we really do hope that you as sisters and brokers are able to be there to support them. Last thing I did want to talk briefly about is we covered the transition to Medicare in that middle section. Thanks, Phil, for covering that. It is an area that we've covered a few times before, but it's a really important topic because it's something that customers don't realize that they need to take action on. So that's why we are working with the sister brokers to make sure you're aware and you can help educate customers that they do need to come in and terminate their Pennie coverage once they do enroll in Medicare. We've also started doing, we've been doing this for a little while now, doing outreach to customers who about 3 months before they turn 65, so around the same time they can start doing the work to sign up for Medicare. We've been doing proactive outreach and emails, outbound calls to make sure that they understand what they need to do as they're working through the process of enrolling in Medicare. And reminder that if somebody is eligible for Medicare, but only for the Part A with a premium, those folks, which is a small population, but it's an important population, those folks can still be eligible for APTC. And a lot of the time you might see those folks in some of the populations that Eric covered. So they might be, an immigrant household who hasn't met enough of the quarters to get premium-free Part A. For those folks, those folks might really benefit from getting APTC and enrolling through Pennie instead of having to pay the premium for Medicare. So for those folks, it's important to help them understand their options. So I just want to cover those pieces there. We've covered some Medicare transition items in previous sections, but I think Phil covered it really well today. So if you have any questions, obviously, please don't hesitate to reach out, and I will hand it back to Marie to close up for today.
Thank you so much, Hannah. So we hope that you found today's sharing of information valuable. We really do work hard to bring you insightful topics with the aim of helping you better serve customers. So as always, we thank you for your commitment towards breaking down the barriers and helping Pennsylvanians get and stay covered. We also thank you for spreading the word, right? Because that's word of mouth is obviously a good thing. So thank you for spreading the word about the affordable plans, the financial assistance, and also the pathway to coverage through Pennie. We wish you a happy Friday and a pleasant weekend. Here on this slide, you'll find our contact information. We have the contact center there and the hours, as well as our email addresses. So until next time, stay safe and goodbye. Talk to you later.